There are four main options for treating feline hyperthyroidism. I will go into more detail on them in separate videos, but for an overall look, the most common is medication, some form of methimazole, and that works quite well. But the trick is dosage. The second would be surgical removal, which early on was very common. It's no longer the preferred method. There is the Hills YD food, canned and dry, which, even though I've listed it third, I consider to be a last resort option. For one thing, the canned is not really very good nutritionally, and the dry is just plain hideous. It has no meat protein, and partly that's because the food works by highly restricting the iodine intake. And depending on whether you go by the studies that Hills paid for or studies they didn't pay for, it's either highly restricted or possibly deficient. And also, some cats quite simply won't eat it. But that's true of a lot of cat foods. The most expensive and overall the best is the I-131 radioactive iodine. It is a very, very targeted method because in cats, hyperthyroidism is caused by an almost always benign tumor. And the 131 gets the tumor, all the tumor, if done properly, and has essentially no effect on the healthy tissue. And even though it's the most expensive up front, since you get a healthy cured cat instead of a treated cat, you actually end up recovering that cost in about 2 years. So it becomes even the best financial choice. There are a few things that would prohibit doing the 131, and I will get into those in these separate videos. But as with anything, there are a lot of variations. There's also a lot of, on any of these four options, a combination of misinformation on the internet, old information, and sometimes just poorly expressed information. Especially if you're feeling panicked and paranoid when you're trying to read about it, then they start telling you things that just really sound like doom and gloom. But forget the doom, forget the gloom. I would say to forget the paranoia, but I know you're not going to do that. A little paranoia doesn't hurt. So just take heart. You have a lot of options, a lot of sub-options, and even though it can get pretty complicated, they do work. So a hyperthyroid cat has a very good chance at living essentially the same lifetime that they would have even if they hadn't gotten the hyperthyroidism. It just takes patience, well, and paranoia, I suppose, but focus on the patience. I hope you'll watch more of the videos, and I'll be doing more videos. Good luck.